A very good morning to each one of you here. Every year, the Government of India conducts, the Union Public Service Commission conducts an examination to select about 400 to 500 odd best talents in the country to help run the nation. And I'm given to understand that they have a compulsory history paper. And one of the very repetitive questions they get to hear is, what would have happened if the Britishers had not invaded India? If somebody were to ask me this question over breakfast today morning, my answer would be very simple. I think there would be a startup of English translators and would give Flipkart and Snapdeal a good run for the money. And if somebody would ask in the same context, what would have happened if HL7 was not there, I think we'll have 100 odd questions. My answer again is a little funny here. Maybe we would have police stations and courts in each of the hospitals to choose who's right and who's wrong and what went wrong in between. So ladies and gentlemen, today I'm going to spend the next 10-15 minutes to give you a very basic overview of what is HL7, what is HL7 International, and what are we doing as an affiliate, HL7 India as an affiliate is doing in the country, and possibly touch upon what looks like to be the future for healthcare IT with HL7 in the context. With this, I think I'll move to the next slide, which says HL7 International is a consensus-driven standards development organization. I think everybody on the podium has spoken how difficult it is about standardization. I think it is doubly difficult to have a consensus around standards. Hundreds and thousands of meetings are held across the world to get consensus for the standards. Likewise, there are tens of meetings that are held across the globe for consensus for HL7 standards as well. So this gives a sanctity of uniformity and acceptance. So what works in one context might not definitely work in the other context, but yes, it is given to understand that a lot of factors are considered before driving out the standards. Unfortunately, HL7 India is still not come up with India-specific standards, but we are moving towards the direction and we are trying to come up with India-specific standards to be adopted by the relevant stakeholders. So all of us know what HL7 is, but I think not many of us know what actually it means in terms of a technicality involved. So this slide explains there are 7 layers of transport that happens. If I were to take a LAN cable and connect 2 systems across, that's the physical layer. And if I were to transport a pocket of data, that becomes a data layer across a network. Likewise, it goes all the way across even to a session, a presentation, and an application layer. So HL7 standards cover the last mile involvement, and it is a application-to-application connectivity. I'm sure this slide is the most abused or the used one. I think everybody has spoken about scope of standards. What is pertinent and relevant from HL7 is, yes, one of the slides from Supten also had an HL7 DICOM overviewing and harmonization between standards. This is where the HL7 also plays a role to bring in relevant parts to be interconnected between disparate systems, even among standards itself. Let's say between DICOM and Snowband, if there is a scope to be integrated, I think HL7 has a definitive role to play there. Yeah, I think this is the slide which is been inspired by a very famous poem, if doctors differ, patients suffer, from a 1843 slide. I think we are no different. If technologies differ, I think the patients still suffer. I'm just keeping the doctors out. So I think even with technology, it has to come to a talking terms to convey the right thing again. So who and where is HL7 International? This is definitely, since its origin in the 1980s, this is headquarters in US, and this is a not-for-profit volunteer-driven organization. And it has its various stakeholders who are not only the guys who make the standards, but are also the people who use the standards. So 38 affiliates across the globe. You can see India out there. So we have been one of the very active affiliates. We have 100 odd members today with about 20 institutional members. And we are the highest certifying agency in the world. We do about 60 certifications per annum, which means we not only enroll members, but also certify them being on their conformance to passing the test, be it version 2.3 or version 2.6, and we are also now getting into understand to see if we can roll out certification for FHIR. So as an affiliate, we are an independent legal entity. We are a Section 25 company, which is having a permanent office based out of Bangalore to run the day-to-day activities. We have been influenced and driven. HL7 standards have been influenced and driven by the governments. I think it's very heartening to see the government of India, through its Ministry of IT and Health and Family Welfare, has permanent bodies to enforce standards. And we are also being influenced by vendors. We have been influenced by clinical users, the end users for whom it is meant, and definitely the terminology experts, the ontology experts. And we are all keen to see what we can do along with NEHA and EMA standards committee with the government. And the users, of course, as I mentioned, again, globally it includes a lot of healthcare professionals, including the NHS, for example, or the other governmental agencies and the health agencies across the countries. Okay. And I think this is a very pertinent slide for us to prove directions on what is happening at international level. The standards provide for interoperability that improve the care delivery. I think today is the world where the transport has got its importance as much as the content. The pizza boy who delivers the pizza to you, or the Bansals who deliver the packages themselves. For those of you who read the newspaper today, the promoters of Flipkart have been delivering the packages. I think the transport has today come to an important aspect itself. So, and optimized workflow, I think this is where we have a role as an adoption body to see how much ever can we cut down on the redundancy and improvise on the efficiency of the system. And knowledge transfer, enhanced knowledge transfer among all the stakeholders, including the end user, the patient in question, and practically put our willingness to needs of the stakeholders as the primary objective of the organization. This is more important because, there's so many components which don't work in tandem. They work in opposite direction. This slides explain how there's so many disparate systems. Though we talk about information system being the panacea for half the problems in healthcare, I think a lot needs to be done to put them in tandem, to move them in one simple direction to optimize the efforts. So the market definitely needs a faster and meaningful implementations, tangible syntactic and semantic interoperability. I think this is a big topic of interoperability which all of us have been talking about, and a lot needs to be done in this area. And continuity of care across facilities. Mr. Vishweshwar Konda definitely spoke about it. You move to one hospital to another hospital, you need to still carry your records and briefcases and perhaps files. And to ensure in the process confidentiality and security, and harmonization with other standards, and support the latest communication technology. FHIR has come as a result of a demand for a mobile and cloud-based technology. So I think HL7 is also equally responsive to understand the needs of the communities and come up with appropriate adoption of the technologies. And these are the various working groups. There are more than 65 working groups. We worked in each aspect of healthcare. It could mean as clinical genomics, or could be as non-clinical as policy advisory. So I think this is the extent on the expanse of HL7 working groups, which makes it to work in cohesion with each of the other working group. So this, I think, is, in my view, going to be the future of healthcare informatics along with the way it's going to cloud. There are a lot of devices which track us. I think a lot of us here would be also using Fitbit, which would definitely monitor what you're doing, how many calories have you burned, what is your workout, and to how much of sleep you have lost over the night, which would move to an application which would talk with the services, which would connect. All this to be seamlessly connected needs a messaging platform. And I think there could be no better platform than HL7 to get this to a logical end. This is the website where you can find a lot of interesting articles which are more technical in nature. For those of you who are interested, can definitely go and check on the website. And I would like to end with a 2-minute video wherein I was a part of the project in the US where we used...
Can we see the video in the end?
Yeah, and this is the last slide, sir, any which ways.
Yeah.
Okay, thank you.
Yeah.
Okay, in that case, this becomes my last slide where I think all of our efforts are towards embracing patient relationship and to deliver better patient care. Thank you.